study of the circulation in the smallest blood vessels may be easily carried out in the wing membrane of the common bat, Myotis lucifugus. The technique shown permits observation and recording of these minute circulatory fields in a mammal without use of surgical procedures. The average specimen has a wing spread of about 25 centimeters or 10 inches and weighs approximately 6 grams. The animal is placed in a suitable holder which may be attached to the mechanical stage of the microscope. The one used here is of clear plastic. The glass ring is an optical flat which may be adjusted to permit contact with the undersurface of the wing. After the animal is confined in the cylinder, the wing membrane is extended through the slot and held in this position with light tension spring clips. During manipulation of the wing and mounting the animal, extreme care is taken not to interfere with the main vessels from the axillary region. The final position is similar to that of the wing when extended in normal flight. The two pairs of electrodes make possible either direct stimulation of the nerve to the blood vessels or reflexly induced responses. Oil contacts above and below the wing eliminate surface refraction. The gas inlets in the cover are used when special gas mixtures are employed. The chamber is then fixed on the microscope stage and the field focused in the usual fashion. A zirconium arc lamp supplies sufficient light for high contrast film and allows full utilization of the maximum depth of focus of the optical systems employed. A prism above the objective deflects most of the light into the sidearm, and this allows photographic records of the behavior to be taken. A view of the wing shows the general distribution of the vascular components. The blood vessels form a two-dimensional system with one arterial supply and its corresponding venous drainage. Collateral connections with borders of the area may be observed. Compare the smaller artery with the larger vein. These observations at low magnification show the distribution of the larger vessels. Arteries and veins lie in close proximity to each other and duplicate their branchings throughout the entire field. The arterial branchings are usually formed by Y-type divisions. However, the arteriolar origins most frequently arise as right-angle branches from the small arteries. Within each system, the smaller vessels show frequent interconnections or anastomoses. This produces the arcuate type of distribution so frequently found in vascular systems. In these subcutaneous fields, all arterial blood passes through capillary beds before returning along venous channels. No arterial venous shunts may be found. In general, a local region is supplied by blood that enters through the arteriole at one border and leaves through venous drainage on the opposite side. Thus, with several supplying arterioles, the flow lines meet and cross in the capillary nets. At higher magnification, the structure and behavior of the blood vessels in relation to their environment becomes apparent. The ring-shaped structures are fat cells. An artery and its associated vein are followed toward the capillary net. The artery lies above the vein, and between them a nerve is seen. The velocity of flow in the vein is less than in the artery and exhibits irregularities. This aspect of venous flow is related to the pumping activity of its wall and has no connection with the arterial pulse. Just beyond the band of connective tissue which crosses the field, a nerve branch is observed to pass upward. In addition to the vascular elements, one sees paralleling them the lymphatic vessels. These drain extra fluid from the tissue spaces into the large veins. The circle marks a valve sinus in the lymphatic channel. The marked contractility of these lymphatic vessels is clearly evident in this region. The lymphatic capillaries in the wing membrane are fewer than the vascular capillaries and appear as large, sac-like structures lying in the interstitial space. An arteriole branch is followed toward the left. From this, an arteriolar vessel arises and carries blood to be distributed in the small bands of skeletal muscle, seen to traverse the field from lower left to upper right. The intermittent flow in this arteriole results from active vasomotion along the vessel. The blood is seen to divide into the capillaries that parallel the muscle fibers in their distribution. After following for variable distances within the capillary net, converging vessels, indicated by the ellipse, carry the blood toward the venous drainage. A sebaceous gland associated with a hair in its follicle now occupies the center of the field. Returning along the vein, the origin of the arteriolar vessel whose distribution was followed is indicated within the circle. A diagram of the minute vessels indicates typical relationships observed in these subcutaneous patterns. The blood enters by way of an arteriolar arch. A terminal arteriole and its branches carry the blood directly to the capillary. The shaded nodules along the vessels represent the location of spiral muscle cells. The precapillary sphincter is the last such cell along any part of a terminal arteriole. Through these portals, the blood then enters the capillary net. These endothelial tubes, by anastomosing, form an interconnecting net which is continuous over a wide area. Coalescence of the capillaries form the venous drainage. Actual flow in minute vessels is followed from the terminal arteriole lying within the ellipse to its first branch indicated by the arrow and on into the capillaries. The path through the capillaries is dependent on the conditions in force at the time of observation. In this case, it is seen to leave the capillary by the shortest connection and enter the venous drainage. The intermittent nature of the flow is dependent not on conditions in the capillary, but represents activity in the arteriolar supply. Note the easy deformation of the red blood cells and their varying spacings within the moving blood column. The smaller formed elements occasionally identified in the moving stream are platelets. Although platelets are biconvex discs, their small size and thinness allows them to be observed mainly when viewed on edge. Thus they appear most frequently as rod-shaped structures. The failure of flow through the other branches of the capillary net, here observed, does not arise from active constriction of the endothelial tubes. As the camera follows the various pathways, it will be noted that they are full of closely packed cells that wash back and forth with each pressure change. In this instance, drainage toward the venous channels at the left is prevented by blockage in these channels beyond the capillary vessels. Occasionally, a capillary branch may be completely empty of formed elements. It is not, however, collapsed. Such a branch is followed here toward the right, where it is lost from view in the region of the larger vessels. Blood then moves from artery to vein in these subcutaneous fields through capillary nets, where local conditions determine the specific flow paths